A 54-year-old patient came to me after having 3 implants placed at another clinic, and everything went wrong. The bone began to shrink. The implant was pressing on a nerve. The pain didn't go away for months. And when she asked the doctor, "Why didn't you warn me?" he said, "Well, that risk exists for everyone." No, not for everyone. She had type 2 diabetes, and that is an absolute contraindication, which her doctor knew about, and kept silent. My name is Dr. Dent. I am a practicing dentist. Every day, people come to me with questions they were never asked in time, or with consequences of answers they were never given. This video is not an advertisement for implants, and not an attack on them. This is an honest picture. I will tell you how an implant works and why it is a brilliant invention, who it truly changes life for the better, who it is contraindicated for, and why this is not talked about, what complications exist, and how to avoid them, and what to ask your doctor before signing consent. Watch. This is important. But first, one fact. A fact that changes everything. After a tooth is removed, the jawbone begins to shrink. In the first year, by 25%. After 3 years, you lose a third of the supporting bone. And no one warns you about this in the dental chair. Why? I will explain in Block 3. Look, what is an implant? Most people think an implant is an artificial tooth. No, an implant is an artificial root, a titanium metal screw that is placed into the jawbone. On top, an abutment. This is a connector, and on top of the abutment, a crown. That is the tooth. 3 components, 3 stages, months of work. But here is what matters. This titanium screw literally fuses with the bone. The process is called osseointegration. The bone grows into the surface of the titanium. They become one. This is not glue, not cement, not temporary fixation. This is a living connection. And this is the main advantage of an implant over any other construction. And now, a story not everyone knows. The year 1952, Sweden. A young surgeon, Per Ingvar Bronmark, studies blood circulation in bone. He inserts a small titanium chamber into a rabbit's bone, and after a few months, tries to remove it, and cannot. The bone literally fused with the metal. He calls this osseointegration, and realizes this is a revolution. In 1965, he places the first implant in a human. The patient, a toothless Swede, Gustav Larsson. The implant lasted 40 years, until his death. That is why implants work. Not because they are screwed into bone, but because the bone accepts them as its own, but only if the conditions are right. And that is where the questions begin. Now honestly about the procedure. What happens in the chair? Step 1. Anesthesia. Local. You do not feel pain during the operation. That's a fact. Step 2. An incision in the gum. The surgeon exposes the bone. Step 3. Drilling. Yes, a hole is made in the bone. It sounds scary. In reality, you hear the sound, but there is no pain. Step 4. The implant is screwed in, literally using a special tool. Step 5. The gum is sutured. That's it. The operation takes 30-60 minutes. But this is only the beginning. Then you wait from 3 to 6 months while the bone grows around it. Then the abutment. Then the crown. From the moment of surgery to the final tooth, 4 to 8 months. And here's the first question you should ask your doctor. Is my bone ready for this? Because if not, everything falls apart at the very first step. And now we've reached the most important part. The reason you started this video. Contraindications. I will divide them into 2 groups. Absolute, when it is definitely not allowed. Never, or until the cause is eliminated. Relative, when it is not allowed now, but possible under certain conditions. Write this down, or save it. This is a list that can save your health and your money. First, Type 1 diabetes, an absolute contraindication. Why? Because diabetes impairs microcirculation. The bone receives less nutrition. Osseointegration is a process that requires active blood supply. Without it, the implant does not integrate, or it integrates poorly and is rejected after a year or two. Type 2 diabetes depends on control. If glycated hemoglobin is above 7.5%, the procedure is contraindicated. If blood sugar is normalized, the situation may change. But this is not decided by the dentist. It is decided by an endocrinologist together with the dentist. If you are offered implants without a blood test for glycated hemoglobin, walk away. Second, oncology. If the patient is undergoing chemotherapy, implantation is prohibited. The immune system is suppressed. The risk of infection is critical. Separately, radiation therapy to the head and neck area. This irreversibly changes the quality of the bone and its ability to regenerate. After such therapy, implantation is possible only in specialized centers and only after 12-18 months, and not always. Third, osteoporosis. Look, osteoporosis is not just weak bones. It is a systemic disease in which bone loses density. In severe osteoporosis, the implant literally has nothing to hold on to. Bone density is measured by densitometry. If you are over 55 and have never had densitometry, that's a reason to do it, especially for women in postmenopause. Statistics. In women over 60, osteoporosis in one form or another occurs in 1 out of 3, and no one talks about this during a clinic consultation. Fourth, and this is the most dangerous and most overlooked point, bisphosphonates. These are drugs prescribed for osteoporosis and cancer with bone metastases. They block the activity of cells that break down bone. Sounds good? For bones, yes. For implantology, a disaster. After taking bisphosphonates, the bone loses its ability to renew normally. The complication is called osteonecrosis of the jaw. The bone literally dies. This is irreversible, and it occurs in 1 to 6% of patients after implantation while on bisphosphonates. Never hide from your dentist what medications you are taking, any, even if it seems unrelated to your teeth. Fifth, briefly but important, autoimmune diseases, rheumatoid arthritis, lupus, in the active phase, severe heart failure, unstable angina, a recent heart attack within the past 6 months, blood clotting disorders, use of anticoagulants without adjustment. If you are taking warfarin, Xarelto, or Eliquis, tell your surgeon. This affects the safety of the procedure. Now, relative contraindications. These are situations where, not now, but possible later, if you prepare properly. Smoking. Nicotine constricts blood vessels. Less blood supply, poorer integration. In smokers, the risk of implant loss is 2-3 times higher than in non-smokers. This is not an opinion. This is clinical data. Ideally, quit 2 weeks before surgery and do not smoke for 2 months after. If you are not ready, the implantologist must warn you about this. If they didn't, that's a red flag. Pregnancy and breastfeeding. Not because it directly harms the child, but because anesthesia, stress, and x-rays are undesirable. After childbirth and the end of breastfeeding, there are no restrictions. Young age, incomplete jaw growth. Implant placement before 18 is not recommended. The jaw is still growing. The implant does not grow. After a few years, it will appear sunken relative to neighboring teeth. In some patients, growth continues until 22, 25. A panoramic x-ray over time is the only way to check this. Insufficient bone volume, but this can be solved. After tooth removal, bone resorbs. I mentioned this earlier, 25% in the first year, but this can be corrected. Bone grafting is a procedure that restores volume. This is a separate stage, separate cost, separate time, but it is an option. If you are told you don't have enough bone, nothing can be done, get a second opinion. Psychological factors, unrealistic expectations. And the last of the relative factors, something that is rarely discussed, psychological factors. An implant is not magic. It requires care, regular hygiene, checkups every 6 months. There are patients with perfectionism or dental anxiety for whom the process becomes a source of chronic stress. Good doctors take this into account. If you are physically afraid of dentists, say it. This can be managed. There is sedation. There is psychological preparation. Staying silent is worse. All right, we've covered contraindications. Now, the most uncomfortable part, complications. What is written in small print in the contract and what no one explains before you sign. Watch, this changes everything. You've heard the phrase, implant success rate is 95%. That's true, but it's not the whole truth. 95% of implants integrate. But peri-implantitis, inflammation around the implant, develops in 10% of patients, in the long term in 20-40%. And these are data from the journal Clinical Oral Implants Research, not a marketing brochure. The difference between the implant integrated and the implant lasted 25 years without problems is huge. I will explain each complication honestly. Peri-implantitis. This is inflammation of the tissues around the implant. Essentially, it's the same as periodontitis in a natural tooth, but it is much more difficult to treat. Bacteria colonize the surface of the titanium. Inflammation begins. The bone around the implant starts to resorb, and if left untreated, the implant loses its support and falls out. What causes peri-implantitis? First, poor oral hygiene. An implant requires the same cleaning as a natural tooth, plus flossing tools and an irrigator. Second, smoking. Again. Third, poor placement. If the implant is positioned incorrectly, plaque accumulates faster. Fourth, skipping follow-up visits. Prevention of peri-implantitis is not just brush your teeth before bed. It's a system, an irrigator, special interdental brushes. A checkup every 6 months. Who explained this to you before you got the implant? The second complication, paresthesia, a loss of sensation, numbness of the lip, chin, or tongue. This happens if the mandibular nerve is affected during drilling. The incidence is about 1 to 3% in procedures on the lower jaw. Most often, it is temporary. It resolves within 3-6 months. Rarely, it is permanent. How to avoid it? A CT scan is mandatory before surgery. If your procedure is being planned without a CT scan, that is a serious mistake. The third, for the upper jaw, perforation of the maxillary sinus. If the implant is too long, or the bone above the sinus is too thin, the implant can enter the sinus. The result, chronic sinusitis, pain, nasal discharge. The solution, a sinus lift. This is an additional procedure. It should be proposed in advance if the anatomy requires it. The fourth, mechanical problems. The abutment is the connector between the implant and the crown. It can loosen or break. This is not a disaster. It can be replaced, but only if the implant itself remains intact. As for the crown, it is not permanent either. Its lifespan is 10-15 years. After that, it needs to be replaced. The implant is long-lasting. The crown is not. Look, there's another conversation that rarely happens in clinics. There are cheap implants on the market, and there are expensive ones. What's the difference? Not in shape, not in size, in the quality of the surface treatment. Osseointegration begins at the micro level. The bone grows into microscopic roughness on the titanium surface. High-quality implants have this surface treated to standard. Cheap ones do not. The result, slower and less reliable integration. Plus, well-known manufacturers have a global network of partners. If you move, your implant is recognized and can be serviced. With no-name implants, the company may disappear in a year, and there will be no parts for your tooth. And now, something unexpected. A complication that almost no one talks about. We'll come back to it in a few minutes. First, the good part. Because after all of this, It's important to understand implants are not evil. They are the best solution for many people. Here's who they're for. Who implants are the best choice for? There are three ways to replace a missing tooth. The first, a bridge. The classic option. We grind down two neighboring healthy teeth and cover them with a structure that holds a suspended tooth. Yes, we sacrifice two healthy teeth for one missing tooth. Lifespan 10-15 years. Then, replacement. Under the bridge, the bone continues to shrink. The second, a removable denture. Cheap, simple, but uncomfortable. It presses, rubs, requires adhesive, and must be removed at night, and it also does not stop bone loss. The third, an implant. The only solution that replaces the root. The load goes into the bone stays alive. Neighboring teeth are not touched. You clean it like a natural tooth. Lifespan 25 years or more. It costs more, but you pay once. Advantages. Bone preservation. First and most important, an implant is the only solution that stops bone atrophy, because bone stays alive only when it is under load. A tooth chews, loads the root, loads the bone. A bridge or denture, no load on the bone. The bone resorbs. An implant provides load. The bone remains. After years without a tooth, you will lose so much bone that implantation will require complex grafting. Every year of delay means more problems and more cost. Quality of life. Second, it feels like a real tooth in your mouth. You bite, chew, smile. No one will say that's an implant unless they know. Patients who wore dentures for 5 years and then got an implant all say the same thing. I forgot it's not my own tooth. That's quality of life. Economics. Third, economics. Yes, an implant is more expensive, but a bridge needs to be replaced after 10 years. Replacing a bridge means more grinding, more risks, more costs. Over 25 years, a bridge ends up costing more than an implant. Plus, the crown on an implant can be replaced without touching the implant itself. You come in, replace the crown, and that's it. Who benefits the most? Who do implants change life for the most? First, young people who lost a tooth due to trauma, athletes, car accidents. A bridge is not an option, too many years ahead. Second, people with several adjacent missing teeth. A 3-unit bridge means grinding down 4 healthy teeth. Implants. Each tooth stands on its own. Third, people with allergies to denture materials. Fourth, anyone who wants a full life without food restrictions. If you are healthy, a non-smoker, and have no contraindications, an implant is the best solution on the market. Remember, I said I would come back to something. Here it is. Titanium allergy. It is considered that titanium is completely biocompatible, and that is mostly true. But 0.6% of patients have an immune reaction to titanium ions released during friction and corrosion. Symptoms: chronic inflammation, pain, implant failure without an obvious cause. It is difficult to diagnose. Treatment, removal, an alternative: zirconia. Zirconia implants. White, non-metallic, biologically inert. More expensive, but for people with metal sensitivity, the only option. If you have allergies to metals like nickel or chromium, tell your surgeon. This is a reason to discuss zirconia. How to choose a doctor and a clinic. Look, this is your tool for protection. 5 questions you must ask your doctor before signing consent. First, did you do a CT scan? This is mandatory. Without computed tomography, it is impossible to accurately assess the bone, nerves, and sinuses. If you are being scheduled for surgery without a CT scan, walk away. Second, which implant system do you use, and why this one? A good doctor will explain the brand, country of manufacture, and advantages. A bad answer. Well, it's good. Proven. Third, what are my risks considering my health? List all your diagnoses and all medications. Watch the doctor's reaction. If they didn't ask a single question about your health, that's a disaster. Fourth, what if the implant doesn't integrate? A good clinic will explain Plan B, replacement, bone grafting, refund in case of their error. If they say everything integrates with us, that's a lie. There is no 100% guarantee. Fifth, how many implant procedures have you personally performed? Not the clinic, this specific surgeon. An experienced surgeon has done at least 300, 500 procedures. This is a normal question. A good doctor will answer without taking offense. Red flags. And finally, clinic red flags. The consultation is free, but lasts only 5 minutes. They don't ask about your medications or medical conditions. They promise a 100% result. There is no CT scan in the clinic, or it's not included in the treatment plan. They pressure you with urgency. Offer valid today only. There is no contract with a detailed description of guarantees. A good clinic doesn't rush you. A good doctor doesn't promise the impossible. He asks questions and answers yours. If this video gave you answers, leave a like. Not for me. For those who need these answers too. The YouTube algorithm will show it to people who are right now searching, should I get dental implants? Save the video and share it with those who are considering implants. It may save someone from a serious mistake. See you in the next video.